Well, do you have memories of the presidential fitness test with all those pull-ups and sit-ups? It has been out of schools for more than 10 years now, but President Trump recently signed an executive order to bring it back. The test was created under President Lyndon Johnson in 1966. It included running, the sit-ups, the pull-ups, and more. In 2012, President Obama got rid of the test over concerns it focused too heavily on competition. It was replaced with a broader program that was more focused on health than athleticism. But now, President Trump says that test will be recreated and established by the President's Council on Sports, Fitness, and Nutrition. Dr. Jacqueline Goodway is a professor of kinesiology at Michigan State University, who's going to say it much better than I just did. But thanks so much for joining us.
Good evening.
I have so many memories of this test. What are the criticisms, though, of this fitness test from a medical standpoint?
I think scientifically, there are a number of criticisms. The test is focused on a fairly narrow range of skills, such as the 50-yard dash, like you said, the sit-ups, the pull-ups, the shuttle run. And it's not very health focused. It's more focused on performance outcomes. I think the other criticism is not so much about the test, but the way it was implemented back in the day. And I'm sure a number of people watching TV right now just remember dreading the moment they had to go out and do that test. And there was a sense of public humiliation for
Yeah.
some people. So I think it's really important that we, as he brings his test back, that we think about reinventing it a little bit and using broad scientific knowledge and kinesiology to make it a better test than it was.
Dr. Goodway, we talked about the criticisms of all this. Are there any parts of the test that were known to be useful or effective?
You know what? Anything that elevates a discussion about youth fitness, youth physical activity is important. And so when I saw this executive order, I was excited because it certainly brings back to the conversation the importance of getting our young children and our youth moving. There are parts of the test, it was a really good benchmark for where our students were at in terms of their physical fitness. And so we had good national norms to kind of understand where children were at. We could actually build some policy off of it. But I think as we move forward in implementing this sort of version 2 of this test, I think there are a number of things that we can do to make it better.
Yeah, on that note, what are some proven ways in order to encourage exercise for children who aren't typically active?
I think relative to the test, you could gamify the test. One of the criticisms of the test is that it rewards the strongest and the fittest of all children. But what we actually really need to do is we want to take children where they're at in their physical fitness and just get them to improve a little bit each day. And so really focusing on the behavioral component is important. I think the other piece that we understand now from science is that it's not just about fitness. It's about motor skill competence. It's about motivations, perceptions of competence, and all of that will encourage children to be active and feel good about being physically active. And then ultimately, they will end up being more physically fit.
Yeah. As someone who was never able to pass the pull-up portion of this test, I'm not against doing this in private either. Dr. Jacqueline Goodway, thank you very much.
Thank you.